So basically, we are teaching the subjects which are related to medical field. Some subjects are going on like anatomy and physiology and electrohomeopathy. But some doctors are there in electrohomeopathy or alternative medicines like acupuncture, hijama, and naturopathy. So basically, they need some basic pathological and radiological subject to understand what are the terms and what are the diagnosis is given by the modern medicine or modern doctor. So basically, so this is this course for everyone who want to learn radiology, want to increase the knowledge in radiology, want to know the terms and know the relation between body and radiology. Okay. So basically, what does radiology mean? Radiology means it is a study of radiation. What is meant? It is a study of radiation. Radio means radiation. Radio means radiation. Ology means study. Okay, study of radiation. So with the help of radiation, we will able to study our body. Okay, so this is the basic principle of radiology. What we can study. So basically, whenever we study our body, it is in disease form, not in health form. Okay, so radiology will help us to know the structural changes in the structure of the body. Okay, so in anatomy, we will study the structures of the body. Okay, so how where is our bones? So how many bones are there? Where they located? And structure. What is the structure of the bone? Okay, so how the movements are going? So where the muscles are there? Where the nerves are there? What is the connection between these nerves and muscles and bones? Okay, so basically these are the things we learn in anatomy, but it is in normal condition. Okay, we have two types of anatomy, basically general anatomy and pathological anatomy. Means the structural changes after a disease enter into our body, or any changes in the body. The changes bring the structural changes in the body. Okay, so basically, with the help of radiology, with the help of radiation, we will able to study the pathological or structural changes which will going in our body will be studied in radiology. Okay, so I think you understood the basic definition of radiology. Okay, so let's come to the introduction part. This is the base we have to understood and come to introduction part. So basically, in this course, we are going to study about these are the things, okay, which are very important to us in our daily clinical practice. So we will study that much things in our class. Okay, so today is the introduction topic. So I will explain what are the types of radiology are there, how many types, how many, uh, how we will study this course and how it is further helpful in our clinical practice. Okay, so basically, first topic is general radiology. General radiology will take more 1 day or 2 days. Okay, then we will study systematic radiology. Neuroradiology means just structural changes which happen into our brain, spinal cord. So how, if you take the photocopy, we are smiling. Okay, we have smile face. Okay, so we are taking photo. Okay, we have smile face. Okay, so basically this face is clicked and we will see in the phone. Okay, say likewise when you are sending a patient to the any scanning center, he will also click the images with the help of radiations. Okay, neuroradiology means the brain, the spinal cord, and we have peripheral nerves, motor nerves. Okay, and we have sensory nerves. We will examine the nerves, okay, with the help of radiation or radiology. Okay, next we have, so what are the important scans to be done in neurological conditions and how to study them? Okay, and what are the different types of scans are there in neuroradiology? We'll study uh, the basics and what are the importance in our clinic. We will study all those things in that chapter. Next, we have cardiothoracic radiology. Cardio means we have cardiovascular system. Okay, we have thoracic system, thoracic and cardio, both are related to each other. So that's the reason here they given both connected. They are both interconnected to each other. Like we have heart, arteries, veins, and we have lungs. Okay, so we will study about the how what are the scans to be done, like X-rays. Okay, and we have ECG and we have 2D echo. Okay, so these are the common. We will study those things and how what are the clinical conditions are there which are related to this chapter. Next, we have gastrointestinal and genitourinary system. Okay, gastrointestinal and genitourinary system. These are the systems we know about digestive system and urinary system. Okay. These are the systems we will study. Next, we have musculoskeletal system. Musculo means muscles. Musculo means muscles. Skeletal means bone. Okay. So these are about muscles and bones. Muscles and bone we will study. Okay. How the bones look like if we have x-ray, we have accident, if a person is fell down, so he have fracture. So what are the different types of fractures and how to be see in our x-rays, how to be study in x-ray. X-ray will study in I think please mute. Okay, so basically, so we will talk about muscles and skeleton. Skeletal system are connected to the muscles. So there's the reason here muscles and skeletal system are given in one chapter. So next we have radiotherapy and nuclear scans. Nowadays, radio and chemotherapy are very common because of the deadly disease which are spreading all over the world. Okay, okay, all over the world. So that's the reason nowadays chemotherapy and radiotherapy is common in mostly developed countries. Okay. Next, we have nuclear scan. Okay. So what are the scans to be done? and how it performed, how the clinical conditions to be studied in this scan we will study. Okay, next, what are the important things we have to remember? So this is the content of our class. I think this chapter will complete it in 2 days. This is it will take 3 to 4 days. Okay, all the chapters 5 days minimum. Okay, 5 days. Okay, 5 days means uh, this will take mostly 20 days, 22 days, and this is 2 days, 2 days. Okay, this is 2 days. So 6 plus 22, 28 days. So I am targeting 30 days. Okay, 30 days. Weekly 4 days is given for our class from 8 a.m. to 9 p.m. So this is the timing of the class. So basically we will study in both Hindi and English. Okay. So first I will explain in English, then what is the important things related to the topic. I will again explain in Hindi also. Okay. So the fees is 1500 rupees for this course. So who is already paid? So they don't worry to pay it again. And second thing is who are my students already in the group. Okay, I already messaged them personally. Okay, so about those things. So whatever the protocol given to the class students, they will follow. So other than my students or other persons, they have to pay 1500. So let's see some general things in general radiology. Okay, so I told you that with the help of radiation, we will study the structural changes in the body or pathological conditions in the body. This is a simple and easiest definition. Okay. So basically, in the space, we know that in the acupuncture, we know that in our space, we have chi or in every uh, whatever space is there. So we have chi. So with the help of chi only, energy. Chi means energy. With the help of energy only, we are living. We are living. So if there is no chi, the person will die. So same here. So the energy, we have energy. So the energy which is comes from any place, okay, which is coming from any place. So we have to uh, store that energy. Here, what happening in radiology? We are s- we are storing the energy in a specific place, like in specific material. Okay, the energy will travel from that area to the person's body. Okay, person's body in radiology. So then the image of the internal organs or external organs will be clicked while the radiation is going through the body. So this is the second step we have to understood. So how the radiations are stored. Okay, this is the simplest way. We have to remember that these radiations are stored in a particular chambers, particular material. Then we have to pass those radiations from the body to know the internal condition of the body or external condition of the body. Okay, so these radiations have different types of uh, charges, mass. So I think these things we are unable to learn. These things are difficult to learn us because this is not helpful to us. First thing. Second thing is that the radiologist who is the specialized person. So the person will have the knowledge about that. Well, because we didn't practice in everyday daily life. But the definitions are these are the things we have to remember. Okay. Next is what are the different types of radiations? So we have electromagnetic radiation. Those electromagnetic radiations may be ionizing, non-ionizing. Okay, so maybe the ions are particularly the energy ions are particularly stored in a place, then the energy ions will reach the person's body in a particular area. Okay, so this is the first thing we have to remember. Okay, the ionizing means the stored form of energy in a particular place. With that help of energy ions, the body will seen. Okay, non-ionizing means the energy will not store. Okay, it will come from any source. There is any, like we have sun. Sun is sending his energy to the earth with the help of uh, with his own energy is formed in the sun. So the energy is uh, putting upon the earth. Okay, so the basically this is non-ionizing. Like we have UV rays, visible rays, infrared rays, microwaves, we have radio waves. So the energy will not stored. But here we have X-rays. If you see the X-ray machine, the machine have particular amount of energy stored when you are plugging in the uh, uh, plug electricity circuit. So the energy stored energy will have one one particular space, the energy is stored, the energy is traveling from the source to the targeted area. Okay. So basically they are X-rays, cosmic rays, okay, alpha rays, beta rays, proton, neutrons, all those days. Okay. So in the ionizing radiations, basically the ionizing radiations are used for basic purpose, and non-ionizing purpose is for most deepest tissue we have. If you want to know the deepest tissue, okay, we want to support to see the deepest tissue, we will use non-ionizing. So where was ionizing and non-ionizing are used for the, like we have bone. Okay, we want to study the bone, you will do the X-ray, or if you want to see the most small types of fractures, you will do CT scan. Okay, if it is smooth space. Okay, next we have MRI. Okay, this is non-ionized because if you want to study the deep level study like brain cells, okay, or tendon, or we have the ligaments, so you will able to study those internal organs, deep tissues with the help of MRI. Okay, so what are the ionizing radiations are there? We have X-rays, okay, and gamma rays and non-ionizing. X-rays are CT scan, radiography, DEXA, IVP, IVU. Okay, these are the things we will study. HSG, bronchography, ERCP, and fluoroscopy. Gamma rays are used PET scan. Okay, PET scan, bone scan, radionuclide scan, SPECT scan. And you have non-ionizing in MRI, USG, thermography, Doppler, MRCP. Okay, so these are the scans which are differentiate from ionizing and non-ionizing. So these are the next other things are related to the technician or the radiologist. So I think it is not important. So I will not teaching that, okay, in that course. But we will study about harmful effect of radiations. Okay, harmful effect of radiations. Because ionizing, I told you that it is free radical. It is comes, it will go, and it is doesn't store in any particular space. Okay, because like example as given from the sun, the direct radiation will fall upon the earth. So it is in normal range. It will not damage any part or any substance, but it is above the normal range. So what will happen gradually? It will harm the substance, harm the material, harm the human body. So first damage it will occur on DNA. Okay, we have nucleus. In the nucleus, we have DNA. We have cell. In the cell, we have nucleus. In the nucleus, we have DNA. Okay, so this is the thing most important we have to remember. And we have other side effects like skin erythema. The skin color will change and the skin tissue will dead, or some persons have skin allergy or some other things, and if he exposed more than normal range for a longer period, he will have skin cancer also. Okay, first is. Second is patient have to be protected from that radiation. So basically uh, the main protective agent of the body or protection of the body is mainly depend upon the skin, because it doesn't have skin, then whatever pathogens are present in this universe, it will enter into our body easily. So God gifted us a precious protection material, that is skin. So basically the radiation will expose the first organ exposed by the radiation, that is skin. So first thing, the radiation will damage the skin, then gradually it will enter into the body, and gradually it will harm the person. Okay, like some persons have gray hair or white hair. The color of the hair changes, even on the body also. I saw the many persons who is doing it as a job of technician in radio department. So in early age, premature gray of hair is seen. Okay, their bones are weak. Okay, their muscles are weak. Okay, the skin of the color of the skin is changed. Why this is because of the harmful effect of radiation. And some female patients which are who have uh, who are in pregnant cycle, pregnant women also, it will damage the fetus. Okay, it will damage the pregnancy also. If the radiation will uh, attack upon the female reproductive organs. Okay, and some radiations will also damage the reproduction of male also, reproductive organs of male, and the cycle of the woman also, because they have the cycle. Okay, they have the cycle of menstrual cycle. Okay, so in some cases it will bring infertility in the woman, and okay, erectile dysfunction in men. So basically these are the same in nowadays is common. These are the conditions which are seen in our daily practice. Most of the cases, okay, in some cases the reason is radiations also. Okay, the expose of radiations. In our mobile phone also we have radiations. Okay, so basically the radiations will because it is not in normal range, above normal range, so it will damage our body. Okay, so we have to remember. So basically we have uh, radiology, which is mostly in this era we are seeing the digital radiology. Mostly whatever scans are going on, the mostly are digital radiology. It may be computer radiography or direct radiography or digitizing conventional film. Okay, so basically digital radiology, with the help of computers, with the help of modern techni- uh, techniques, we are using the radiations to see the pathological condition in the body. Okay, so basically we have computer radiography. Okay, and direct radiography also include. Direct radiography means you are taking a machine and you are taking the image of the a picture of the person's internal organs or external organs. Computer radiography means machine is there and some sort of software is needed to see the internal organs of the body or particular machine with the help of machine, computer, and particular uh, uh, with the help of technique. You are seeing the internal parts of the body, that is computer radiography. In the direct radiography, one patient is going to the X-ray machine for taking X-ray. So the person is clicking the image is coming. So it is direct radiography. Computer radiography with the help of computer and any software, and you need the machine, everything is needed. Okay. So basically, in the mostly computer radiography, we will see the advanced things. In direct radiography, basic things are seen in direct radiography. This is the difference between direct and computer radiography. Okay. Here also advantages are given. Okay. Advantages of computer radiography: manipulation and position of image receptor for cross-table projection is possible. Okay. Slower, more complex workflow, possibility of repetitive motion injuries due to long-term castle handling. So basically, direct radiography, if you take the image, okay, after that image, if you want to take some other images, you can't able to take those images. If you need the patient, okay, you need the patient and you have to be stand there and you have to click the image. Okay, this is the one thing you have to remember. And another thing is computer radiography. You can if you take the images, you can see whatever you want to see in the body, in the particular area which is seen by the radiation. Okay, these are the things we have to remember. And we have mammography. I told you that this is uh, here it is given that ionizing and non-ionizing radiation. Okay, in we have non-ionizing, we have mammography also. With the help of mammography, what we will study? We will study many things related to uh, means it is a technique of to study the chest, okay, and abdominal. Okay, it is helpful. Okay, and we have other techniques like ultrasound. We will study in detail. Okay, ultrasound is there, and in the ultrasound we have uh, Doppler also. Ultrasound normal and ultrasound Doppler. Doppler is advanced. Okay, and ultrasound is in every condition of the abdominal disturbance. We will or abdominal pathological condition or structural changes like kidney stones, gallbladder stones, cysts in the female, PCOD, okay, or liver damage, fatty liver, cirrhosis of liver. It will be studied in USG or more advanced. You can advise the patient USG Doppler study. Even if you will able to see the artery, veins in the Doppler study, but in the ultrasonography, you are unable to see the arteries and veins. So if you are using Doppler, Doppler can be done in any part of the body. Lower limb Doppler study, okay, upper limb Doppler study. I will study in the musculoskeletal diseases. Okay, basically, Doppler study is the more advanced than uh, ultrasonography. And we have CT scan. CT scan is also done. Okay, we'll study where it is done, where we have to be used the CT scan, and we have MRI also. Okay, MRI scans. What are the different types of MRI? We will study all these things. We will study. Okay. Now I am introduction part. This is the introduction part. Third, the reason I am not explaining in detail. Okay, what we will study that I am explaining. And the second thing we have to remember that who invented last thing last thing is that who invented this physics. It is a physics, the combination of physics and the medicine. is both combined. So that is the invention of radiology. Here we have Wilhelm. Wilhelm is the scientist, German scientist, okay, who discovered X-ray in 1895. So this is the base study, initial invention of radiology. Okay, Wilhelm in 1895. So we will conclude our class here only. If anyone have any doubts, I will clarify, and I advise all of you to join this class. Okay, it will improve your radiology knowledge as well as some clinical conditions which are going to be studied in this class. Okay, so we are starting from Monday onwards. Monday, the timing is from 8 to 9 a.m. So morning 8 a.m. to 9 a.m.